everyone, and welcome to The Balancing Act. I'm Olga Villaverdi.
And I'm Montel Williams.
Today, we're learning more about inflammatory bowel disease.
Plus, home for the holidays. We're in the kitchen breaking and baking bread.
Ooh, I love bread. And innovative skin and hair care options. Montel?
Am I in that segment?
You don't have to worry about it.
The Balancing Act begins right now.
Let's go. It's about my hair.
There you go.
Across the United States, more than 2.3 million people are living with a condition that can deeply affect every aspect of daily life: inflammatory bowel disease. IBD encompasses both ulcerative colitis and Crohn's disease. Each condition causes chronic inflammation of the digestive tract, but affects different areas and in different ways. To many, patients may look healthy on the outside while quietly managing intense symptoms, dietary restrictions, frequent medical appointments, and the emotional burden of an unpredictable condition.
So I was originally diagnosed with ulcerative colitis at age 5. At that point, I was running to the bathroom like 20 times a day. Around that same time, I went to a theme park, and the only thing I really remember from that trip is how much pain I was in. So it really put a damper on my life as a young child.
Dr. Emmanuel Bellaguarda specializes in the treatment of patients with Crohn's disease and ulcerative colitis.
Inflammatory bowel disease are a group of conditions that are chronic and relapsing that can cause inflammation in the GI tract. There are two types of inflammatory bowel disease: ulcerative colitis and Crohn's disease. Ulcerative colitis affects just the large intestine. It's a superficial inflammation, kind of like a bruise that you have inside the gut. It's red, angry, inflamed, with superficial canker sores. Crohn's disease can affect anywhere in the GI tract. Crohn's disease is a deeper inflammation inside the gut. The inflammation goes through the bowel wall and can start connecting the inside of the bowel to the outside of the bowel, causing and triggering complications, such as tubular structures that connects the inside of the gut to the outside, what we call fistulas, or scar tissue in the gut that triggers narrowings, what we call strictures. The most common symptoms of Crohn's disease is abdominal pain, abdominal bloating, fatigue, and increased bowel frequency. The way that patients present with Crohn's disease can be very different. It really depends where the inflammation is. The most common symptoms of ulcerative colitis are bloody stools, diarrhea, increased bowel frequency, and bowel urgency. These symptoms can be extremely disruptive for the day-to-day life of our patients.
I started trying a whole bunch of different medications to try to get it under control. One of them was a high dose of steroids, so I gained a whole bunch of weight. I had the big moon face, so I was really badly bullied in school. So I was having a really tough time both physically and mentally up until around the age of 10, which is when I was formally diagnosed with Crohn's disease.
Symptoms can come and go in waves, and there are periods of time that the symptoms are gone, what we call remission. Other times, the symptoms come back, what we call flare-ups. One of the medication options that we have to treat moderate to severely active Crohn's disease and ulcerative colitis is infliximab. Infliximab is a man-made protein that targets a specific molecule in the body that induces inflammation in the gut, what we call TNF-alpha. Blocking TNF-alpha reduces the inflammation that triggers Crohn's disease and ulcerative colitis. Our whole goal is for our patients to be well and in remission.
So in 3rd grade, I was hospitalized for about a week, and about halfway through, my doctor came to me and said, why don't we try infliximab infusions? My last day in the hospital, I did an infusion, and I immediately had noticeable relief. I would go in every 6 weeks, and I would get the same medication, and I would have to go back to that same infusion center every time. Since then, I've been on infliximab infusions. I have been in deep remission because of them, and I haven't had any symptoms. I continued on infliximab infusions, and as I started looking into colleges, I had to make sure I was close enough to home that I could come home every 6 weeks. So the infusions were a huge time commitment for me. So driving home would take a whole day, getting the medication, and then I would also lose an entire day, typically just in recovery from the medication. And being a student and also being a theater major, I had a really demanding schedule. I had the opportunity to study abroad, and it's something that I've been thinking about since I was young, so I didn't want to have to miss that opportunity. But with getting my infusions and having to come back to that same infusion center every 6 weeks, it seemed almost impossible.
It's important for the patients to know that they have options. And the options will really depend where they're at in life. What are their goals? It's really a shared decision between us and the patient. We do not want our patients to limit their lives because of this disease.
So my doctor brought up Zymfentra, which is a self-injected form of infliximab, so it's a subcutaneous delivery as opposed to an IV delivery, and she thought that might be a great option for me.
Zymfentra is a prescription medicine used as an injection under the skin, subcutaneous injection by adults for the maintenance treatment of moderately to severely active ulcerative colitis or moderately to severely active Crohn's disease, following treatment with an infliximab product given by intravenous infusion, IV. Zymfentra can lower the ability of your immune system to fight infections. Serious infections have happened in patients receiving Zymfentra. These infections include tuberculosis, TB, and infections caused by viruses, fungi, or bacteria that have spread throughout the body. Some patients have died from these infections. There have been cases of unusual cancers in children and teenage patients using tumor necrosis factor, TNF, blocker medicines, such as Zymfentra. Do not take Zymfentra if you have had an allergic reaction to Zymfentra, other infliximab products, any murine proteins, or any of the ingredients in Zymfentra.
My doctor went over the pros and cons with me. She helped me a whole bunch with insurance coverage and all of that. I'm working professionally in a theater space. It's a lot of time continuously, and it's a lot harder to miss. So Zymfentra has really reduced the time required for treatments. I don't have to take time off from work. I get to take my injection in the morning and go about my day. And in theater, they always say the show must go on, and for me, it has been able to.
Talk to your doctor to see if Zymfentra is right for you. And for more information on today's program, visit zymfentra.com or go to our website, thebalancingact.com. Stay tuned for the full important safety information. Before you receive Zymfentra, tell your doctor about all of your medical conditions, including if you have an infection, have other liver problems, including liver failure, have heart failure or other heart conditions, have or have had any type of cancer, have COPD, a specific type of lung disease, have or have had a condition that affects your nervous system, such as multiple sclerosis or Guillain-Barré syndrome, or if you experience any numbness or tingling, or if you have had a seizure, have recently received or are scheduled to receive a vaccine. Adults should have all their vaccines brought up to date before starting treatment with Zymfentra, are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Do not take Zymfentra together with other medicines called biologics that are used to treat the same conditions as Zymfentra. Your doctor will see if you have TB and should do a blood test for hepatitis B virus before you start treatment, while you are being treated, and for several months after you finish treatment. Some patients receiving infliximab products have developed serious liver problems. Tell your doctor if you have jaundice, dark brown-colored urine, pain on the right side of your stomach area, fever, or extreme tiredness. If you have a heart problem called congestive heart failure, your doctor should check you closely while you are receiving Zymfentra. Tell your doctor of any new or worse symptoms, including shortness of breath, swelling of ankles or feet, or sudden weight gain. In some patients receiving infliximab products, the body may not make enough of the blood cells that help fight infections or help stop bleeding. Tell your doctor if you have a fever that does not go away, bruise or bleed very easily, or look very pale. Tell your doctor right away if you have any of these signs of delayed allergic reactions, such as fever, rash, headache, sore throat, muscle or joint pain, swelling of the face and hands, or difficulty swallowing. Some patients have experienced a stroke within approximately 24 hours of their infusion with infliximab products. Tell your doctor right away if you have symptoms of a stroke. Your doctor may decide to stop treatment if you develop symptoms such as chest discomfort or pain that does not go away, shortness of breath, joint pain, or a rash on the cheeks or arms that gets worse in the sun. The most common side effects include COVID-19, joint pain, respiratory infections such as sinus infections and sore throat, diarrhea, injection site reactions, high blood pressure, headache, urinary tract infections, abdominal pain, dizziness, and abnormal liver enzymes.
So it's that time of year when families gather to break bread, and in this case, bake bread. Did you like that?
That's catchy. I like
Thank
that.
you, sir.
And today we're going to make it so easy for you because our friends from Sister Schubert's are here, and they are going to share their ready-to-make breads recipes with us. These are breads that you can bake at home, no prep, no cleanup, and they're always such a big hit during the holidays.
They're so good. Back with us are Izzy Lanaba, T. Marzetti, Vice President of Brand Marketing, and their Principal Chef, Joe Sakura. Great to see you again.
It's good to be here.
Welcome back.
Thanks a lot for being here.
Appreciate it.
Hey, you know, Izzy, why don't you tell us a little bit about Sister Schubert's story, because it's a really good one. It's fun.
Yeah, I love talking about it. Patricia's sister Schubert was born and grew up in Alabama. She actually got her nickname from her older sister. That's where she gets the name sister from. She grew up making bread with her grandma in her kitchen. They loved it so much that they decided to just share it with people outside of home. Fun fact, she is still involved right now in the products that we make every day. Not only because she likes the products to be up to her standards, but just because she likes to make sure that we always have that warm and that welcoming space that she had when she grew up. So depending on what people like, they can like the dinner rolls, they can like what we call our Parker House style rolls, or sweet rolls. They can always be ready to use in any special occasions, just like holidays, but also just on a regular day for your family.
All right, Chef, so how do you maintain that family legacy?
I think it begins with simple ingredients. We start with simple ingredients, put those into time-tested family recipes and share that with folks. And that's exactly how Sister began. It's a natural progression to the recipes that we have today and the products that we have. No mixing, no proofing. They're just pull them out, bake, and ready to go.
And Izzy, I see you have some cinnamon rolls here. They smell, they look delicious, but there's versatility in this, right?
People can make these things at home in their kitchen. Here's the thing, the problem is it is messy, it takes a lot of time, and it takes away from that time that you spend with your
Sister
family.
did it
It
for us
takes away from
already.
the time you spend eating it. That's right.
I will take that over making it.
I love what you've done because, I mean, obviously we could just eat it as is, but you've now taken it to another level. So show us what you have here from left to right.
Absolutely. So one of the things that we love about Sister Schubert products is the versatility. And with the holidays right around the corner, we wanted to feature some recipes that people could use during the holidays. And the first one we have here is the iconic fruitcake. We wanted to make something kind of unusual, and it's using our Sister Schubert cinnamon rolls. And then for just an everyday, or as Izzy said, on a special Sunday, pecan and cinnamon would go so well together, a really simple one that you can do at home. We have our Sister Schubert dinner rolls that we used to make a French onion stuffing. So caramelized onions, some cheese, herbs. That one, we have a hot brown casserole. We take the dinner rolls, if there are any left over. If not, save some back. Some of the leftover turkey, some of the gravy, cheese, tomato, and bacon. And a really quick, simple, and a great way to utilize leftovers.
All right, what are we going to do here? We're going to have
So
some fun.
today, we're also going to use our cinnamon rolls to make the classic pumpkin pie. We've already rolled them out. We're using it as the crust. So we took the rolls, we rolled them out, put them in the pie pan.
So these are the cinnamon rolls.
And these are the cinnamon rolls, and we're just going to make a simple pumpkin pie filling. So in the bowl, I have pumpkin puree and egg, and we're going to add the cream cheese icing packet. We don't want to throw that out.
No, we
So
don't.
we're going to make it as part of the recipe. So we add that to the mix, and then a little bit of sugar. Your favorite pumpkin spice, whatever that is, everybody seems to have their own preference.
Okay.
Just really simple and easy, and then a little bit of heavy cream.
The best part is just rolling out that cinnamon roll down there, which is delish.
How about the best part is the magic of TV?
Yes.
I get to
Magic
go
of
while he's
TV.
pouring that.
So we're gonna
I get to
pour
go
this
open
in.
this up.
So all of a sudden, this is done so quickly. Slam jam, thank you, ma'am.
Magic.
And
Boom. The magic of TV.
My
Wow.
goodness gracious, that looks
Oh, my goodness.
fantastic, Chef.
that's it.
The question now is, how does it taste?
Oh my goodness, thank you very much, sir.
This is fantastic. So for our viewers who'd like information on just the recipes, the products, where can they go?
So if they wanted more about the recipes, they can go on our social media pages. Sister Schubert's Instagram page, Sister Schubert's Facebook page, but then they can also see the live steps to make them on youtube.com.
All right.
If they want to know where to find the products, they can go to their local grocery store. It's in the freezer aisle, in the freezer bread aisle, and then they can also find any more information, details about the product, the recipes, on sisterschuberts.com.
And they can also go and watch me eat it on our website. No, if you want more information, you can always go to our website, thebalancingact.com. Thank you guys so much for being here.
Thanks for coming. And thank you, sister.
Thank you.
Thank you
Thank
for
you, sister.
always being there for us. We'll be right back. Great stuff.
delicious.
Welcome back, everyone. Time to learn more about handcrafted, innovative products that harness the power of nature and science for optimal results.
Let's meet the makers of Aularale.
In recent years, there has been a growing trend towards embracing natural and sustainable lifestyles. One notable transformation is the rise of plant-based makeup, a movement that goes beyond aesthetics to promote eco-friendly and cruelty-free beauty options.
I remember when I was like 8 years old, people used to call my mom for different types of ails, and she was able to make things from plants and ingredients that were not harmful. We are going places, we feel good about what we're doing, and we're only gonna get better.
I was challenged with finding products that did work for me that wouldn't break me out or make me itch or sting or burn. That was a challenge for me. So that was one of the reasons that I began to think maybe I should create a line for myself that addressed my needs, and I realized that other people had the same problems that I had. When I was thinking in terms of skincare, what I thought about was, I wonder if I could make a skincare product from plants. I knew that if I was going to do this, I had to give it everything that I had, and that I couldn't walk out there and be fearful. So I took a really serious faith walk, and I'm so glad that I did. What I was able to create, not only do I love, but a lot of other women and men love the same product. The Aularale brand is absolutely a wonderful product line.
Aularale products are strategically named after plants, as they are the inspiration to make clean beauty products available to everyone.
When you use all-natural products, you're actually avoiding something called EDCs, which are endocrine disrupting chemicals. So if you have altering chemicals, what is that going to do to the human body and fertility? When you have an all-natural line that you love so much, it's like taking all of your kids and picking a favorite one. It's just not fair. If I had to pick one, it's the freshener. And it has this beautiful citrus smell to it, so you just feel invigorated and fresh and clean.
I found with Aularale, I can use it continuously. It smoothed my skin, it controlled my oiliness. In my specialty of healthcare profession, I'm able to provide the resources and referrals for many of the clients and customers that I meet and greet.
Aularale is special because it has everything that you need. You don't have to look anywhere else. My favorite is the moisturizer. I have normal to dry skin. A lot of times, especially in the wintertime, my skin is dry, but when I put on that moisturizer, it makes such a difference.
These products are so special because the Aularale brand actually answers a lot of questions that a lot of people have about their health care, and skin care is included in that. The Herbal Relief Spray and the Foot Care Cream have helped many people who have diabetes to have better skin care. My favorite product is Herbal Relief Spray because so many people have been helped.
I feel the products are special because they are a benefit to the skin.
The line has grown to over 150 items. The reason for that growth is from the past success of our products. We are excited about the future of the business. We will continue to listen, and we will continue to make products that people need.
To learn more about Aularale, visit the website at aularale.com or see the segment again on thebalancingact.com.
Well, thanks so much for joining us today.
Make sure to head to our Facebook page, like us on Instagram, follow us on X, and visit thebalancingact.com to enter our latest sweepstake or giveaway.
So stay safe. Love that, family viewers. We'll see you next time.